Hi everyone, thanks for joining the session. I am Ankita and today I'm joined by Dr. Roopa Rajan. So today we are going to talk about how healthy eating and having a daily exercise routine can really help a Parkinson's patient to improve their condition. It is a part of Marathonix Parkinson's Awareness Initiative. So Dr. Roopa Rajan, before we start, can you just introduce yourself to our viewers and also just can tell us about your interest in this space?
Thank you, Ankita, for this kind invitation to be part of this program today. So I am Dr. Roopa Rajan. I am an associate professor of neurology at All India Institute of Medical Sciences, New Delhi. I am a neurologist and a movement disorder specialist. So I treat patients with Parkinson's disease, dystonia, tremor, and other movement disorders.
Amazing. So let's start by understanding what Parkinson's is. So can you just brief on that?
So Parkinson's disease is actually the second most common neurodegenerative disorder, just following Alzheimer's disease in adults over the age of 60 years of age. So by this I mean it's a neurodegenerative disorder in which some particular type of cells in the brain slowly reduce in number, resulting in the deficiency of a neurochemical called dopamine, which is very important for the normal functioning of the brain. And this lack of dopamine in specific areas of the brain results in some symptoms such as tremor, slowness in daily activities, stiffness in the limbs, difficulty walking. So these are symptoms, typical symptoms of Parkinson's disease. Although it is classically, typically considered a movement or a motor disorder, there are a spectrum of symptoms which are not really movement related. For example, many people living with Parkinson's disease experience symptoms like low mood, anxiety, bowel disturbances, constipation, BP fluctuations, memory problems. So it is really beyond just a motor or a movement related disorder.
Right. Okay. Thank you, doctor. So while it is established that Parkinson's is associated to brain disorder, and as you also explained, so is there a role of diet and exercises to manage the Parkinson's?
Yes, so that's a very important aspect of living with Parkinson's disease. So I would like to start with exercise. So there are two ways in which it helps. So for one, it has been shown that for people living with Parkinson's disease, regular exercise and physical activity may be a factor that can help in sort of slowing the progression of this disease. So as of now, we don't have any medications or any other treatment techniques that can really take away or cure this disease, but the rate of increase in symptoms especially symptoms such as memory problems, walking difficulties, these will be slower in people who have a very active physical and mental lifestyle. And in terms of exercise, it's actually aerobic exercise or goal-directed aerobic activity like walking, jogging, yoga, swimming, cycling. These are particularly helpful.
Okay, thank you. That's great to know. So what kind of diet is usually recommended to a Parkinson's patient to help manage the condition?
So I would say that there is no specific dietary requirement as such. But for some medications that we use to treat Parkinson's disease, like levodopa, their absorption is very closely related to the presence of food in the gut. So these, you have to have a space between these medications and time between medications and your meals. So if a very high protein diet may impair the absorption. So this timing is important to keep. Other than that, dopamine is, present in many naturally occurring herbs and plants there. So, but as far as the dietary requirements are concerned, there are no specific restrictions or what you can eat, or a generally healthy lifestyle with enough protein and vitamins, and that is probably helpful.
Amazing. That's really helpful. Since this condition affects the movement, as you mentioned, so what kind of physical activities or exercises can help Parkinson's patients to improve their condition?
Yeah. So as we discussed a while earlier, it's basically aerobic activity and a goal-directed aerobic activity such as yoga or jogging, cycling, swimming, even Tai Chi, So these are shown to have be more helpful than exercise such as say weightlifting or so. And for people at the early spectrum of Parkinson's, with early Parkinson's disease, where balance and are not great issues, any of these activities should be equally good. But for people with little advanced symptoms, then a good physiotherapy regime with very much focus on gait training exercises may help manage the gait problems.
Amazing. Thank you for that information. It seems that it is possible to manage Parkinson's. However, I'm just curious to know that Parkinson's is curable or not.
So that's a very important point to bring up. So as of now, there is no known cure for Parkinson's disease, but this is not something that one should, for not a matter for much disappointment, because there are many other diseases, lifestyle diseases like diabetes or hypertension, which are similarly not really eradicable or curable. But there are a lot of very effective medical as well as other therapies available to control the symptoms of Parkinson's disease. And most people with Parkinson's disease are able to live near normal lives with the help of these strategies.
It is interesting to note the advances in treatment, doctor. What is deep brain stimulation?
So deep brain stimulation is a particular specific type of advanced therapy that we use in patients with Parkinson's disease who develop some or who experience some significant motor symptoms despite best medical therapy. So by this, I mean, in the initial years with Parkinson's disease, medicines are quite effective in controlling the symptoms. But as the years pass by, many people start experiencing what we call fluctuations in their symptoms. That is, when they take the medicine, the effect appears, but this effect wears off in a few hours. And sometimes they experience abnormal involuntary movements when associated with these medicines. So there are several strategies to manage these problems when they occur. The first one is, of course, adjustment. One is not able to control these symptoms optimally, then deep brain stimulation is a standard of care in the setting. So deep brain stimulation is actually a surgical procedure by which we implant certain electrodes into the movement controlling areas of the brain. And with the help of a connecting wire, we connect them to a pacemaker of sorts, which is implanted into the chest wall. And through these, current is delivered to the brain to control the symptoms of Parkinson's disease while simultaneously reducing the medications. So this is deep brain.
Okay. So doctor, does deep brain stimulation cure the disease?
No, deep brain stimulation is not a curative treatment. There are no cures as such for Parkinson's disease, but it is a treatment strategy that helps to control some specific symptoms of Parkinson's disease more effectively compared to medications after a certain point in the disease.
Right. Okay. That is a really positive impact. But can you explain what happens during DBS or deep brain stimulation in detail?
So as we just discussed, this is a procedure by which a pacemaker is implanted into the chest wall, and then some electrodes are implanted into the brain, which are connected to this pacemaker, which delivers current to control the symptoms. So it is a surgical procedure, which is essentially comprises of two stages. The first stage involves the brain implanting the electrodes in the brain. So this is generally done under local anesthesia. I mean, with the patient awake, and with some numbing injections to the scalp, surgeons make small keyholes in the skull through which these electrodes are inserted. During the surgery, we take some recordings from the brain and also give current and look at the response, the patient's response, whether we are, at the right area to get a good benefit without any side effects. And once the location is confirmed, the final electrodes are implanted. And then the second stage of the surgery involves usually general anesthesia. And during this time, the connecting wire and the pacemaker in the chest wall is implanted. So this is the pacemaker requires some programming, and this is a series of steps in which we gradually increase the current and simultaneously reduce the medication to attain a stable effect and control of symptoms.
Okay, thank you. So DBS involves the use of electrodes, as you mentioned in the procedure, and seems a bit invasive. So is it a safe procedure?
So every medical procedure, be it surgery or medications, has its benefits and risks. So one of the important decisions that a patient or the caregiver and the treating doctor have to make is to go for any treatment or intervention when the benefits are likely to outweigh the risks. So we talked about some of the benefits of DBS in terms of, control of motor symptoms, tremor, slowness, stiffness, dyskinesias. And there are some risks associated with the procedure. So the two major risks are generally infection or bleeding in the brain during this surgery. But the rates of these happening are usually less than 2 to 3% in most experienced centers and literature. So overall, it is considered a safe procedure with the benefits outweighing the risk for most patients. But this is an individual decision and a risk assessment that has to be made for each individual patient by the treating team. And then only if we feel that the benefits outweigh the risks, do we go ahead with this procedure.
Okay, amazing to know that. Yeah. So those are really great tips. Do you have any other advice for patients on how to maintain a healthy routine while dealing with Parkinson's disease?
So I think it's the most important thing is to stay positive and stay active. And I always feel that, this is, it's a journey. It's like a companion for life. So one should not think of oneself as a patient with Parkinson's disease. It's a person living with Parkinson's disease. So we say that, I have diabetes. I don't say that, we don't say that I'm a diabetes patient. So Parkinson's disease is just like that. So it's a symptom, it's a disease, but it's something that is there, but it's something that can be very effectively managed with available medications, surgical options, other device-assisted therapies, and with staying active physically, mentally, cognitively, and staying positive can.
Okay, thank you, doctor. That's really very helpful information. So I think thank you so much, Dr. Roopa, for your time and sharing all the expertise and knowledge on this topic, because I'm sure that a lot of people hearing this conversation will find it very useful, and you really helped all of us to understand that how healthy routine, eating right, and having a exercise routine can really help to manage Parkinson's disease. And everyone, to remember, we all have so many resources and support groups where we can reach out for help when facing challenges to overcome in Parkinson's condition. So yeah, thanks everyone for watching. I hope this was useful.